Good evening, everyone. My name is Missam Merchant. I am the Executive Vice President of San Antonio Indian Nurses Association, and I'm also the Hospital Supervisor at University Health System. We wanted to go on FB Live today with you all, but because of technology challenges, we're not able to be FB Live. So we decided to record the video and then we would upload that on social media. I'm really excited for today. I have with me a very well known person who is the clinical ambassador for COVID 19 for our Metro Health city of San Antonio, Veronica Rodriguez. We are excited to have her. So I will give a couple of minutes for Veronica to actually introduce herself so that we can get going with our topic today.
Good evening, everyone. Thank you for joining me tonight. My name is Veronica Rodriguez. As Mr. Merchant stated, I'm the COVID-19 Clinician Ambassador. I started in this role maybe about mid-March, and to be honest, with all the evolving processes and changes and all the different information around COVID-19, it was difficult at first to provide all the information to providers, but I, took a really strong interest in that, providing information to all the physicians here in San Antonio so that they could take better care of their patients without having to have that concern of constantly keeping up with all the information.
Wow. So, Veronica, what was your previous background? You are currently a nurse practitioner, is that correct? So, before Metro Health, what did you do?
Yes, so before Metro Health, I worked at Methodist Hospital as a nurse in the neuro ICU. And actually, on top of working at the Metro Health Department, I do work at BAMC as a nurse practitioner with the neurosurgery department.
Perfect. And it seems like public health is your passion because you've been reaching out to everyone. You've been really, from the beginning, I have been seeing your passion and dedication to improve education, level of knowledge, misconceptions, and stuff like that regarding COVID-19. So it seems like you just fell into public health, or is public health and population health your passion from before?
So to be honest, I did fall into it. I was in between jobs. It initially started just working the COVID-19 hotline. It was a temporary position. And then I just kind of took a passion to it, providing that information to the doctors and the public, dispelling any misinformation. All of this is new. So I want to make sure that everyone has the correct information.
Wow, wonderful. Well, thank you so much for being here. We welcome you. We are grateful at San Antonio Indian Nurses Association to have you help us kind of get this knowledge forward. So the purpose of this seminar is to for Veronica to give us some idea about the COVID-19 vaccine. Where the vaccine is currently and what information, the initial information we have available, knowing that as things progress from this month to next month, and as we come closer to having a vaccine, which we don't have right now, we will have more information and different information as we saw in the last 6 months with COVID. So, disclaimer to everyone, this is obviously initial information, basic knowledge, initial information that we know and we have that may change. And I'm sure Veronica is going to touch on that. So, over to you, Veronica.
Yes, thank you. Okay, so let's go ahead and get started. Like we stated, this is initial information that we have right now. Of course, it can change. And to be honest, it could change tomorrow. That's how, this information is always constantly changing. So I wanted to start off by just discussing what is occurring at a local level. So the San Antonio Metro Health Department is following the guidance that was set out by the CDC, which was released September 16th, in a playbook called the COVID-19 Vaccination Program Interim Playbook for Jurisdiction Operations. And this is going to ensure that the San Antonio Metro Health Department distributes the vaccine in an equitable and safe manner. We are also attending weekly planning calls with the CDC as well as the Texas Department of State Health Services. Some key assumptions for the COVID-19 vaccine include the vaccine distribution, which at first we are anticipating the supply to be available by early November 2020. And then we're also anticipating this supply to substantially increase in 2021. Now, at first, the supply is going to be very limited. So it's going to require a phased distribution approach within different tiers. And tier one has actually been federally mandated by the United States Health and Human Services Department. And this first tier is going to include first responders and healthcare providers. Tier two is actually going to include essential workers as well as teachers, and our city's community response coalition team is actually spearheading tier two. Okay, so as you all know, there's a lot of discussion on the vaccine and how it's going to become approved. So it's either going to be approved as a licensed vaccine or have emergency use authorization through the FDA. Now, there's been a lot of discussion on safety and efficacy. And so the FDA is actually requiring the vaccine candidates to provide 2 months of safety data. Now, the reason for this is that they want to ensure that the candidates who receive the vaccine do not have any side effects or any severe side effects, and those should be reported by the manufacturer. And this 2-month period is also going to allow for full vaccination of the individual, and it's going to be able to show whether or not any side effects occurred. Okay, now this is one that us at the Metro Health Department are looking at really closely, because these vaccine candidates that are out right now, they're having very stringent requirements in regards to the cold chain storage and handling requirements, anywhere from shipping and storage requirements, which can really have an effect on the vaccine and the degradation of it due to lack of preservatives. The vaccine storage requirements are going to vary from just being needed to be refrigerated or needing to be ultra cold frozen. The CDC actually recommends for anyone who wants to be a COVID-19 provider to complete an educational training module called You Called the Shots. And I've included that link here for you in case you're interested in learning more about that. Okay, so another topic I wanted to talk about is the actual vaccine itself. What is vaccination going to look like? Well, we are assuming that the first vaccine that comes out is going to require 2 dosages of the vaccine in order to achieve immunity for most of the COVID-19 vaccines. And what's interesting about this is that you're actually going to require 2 dosages, but it's going to be by 21 days or 8 days. And that presents a little bit of a challenge in that the providers are going to need to remind their patients when to come back in for the second dose. And also, we don't know if 2 separate vaccines are going to come out at the same time. So it's going to be very important that patients don't mix and match in between vaccines. So ideally, the patient would present to the same provider or location for the second vaccination. I wanted to highlight this slide here. It is some guiding principles set up by the Advisory Committee on Immunization Practices. And I don't think that safety was put on top accidentally. I think it was put there on purpose, because safety right now is something that everyone, all the manufacturers, all the healthcare professionals involved in this vaccine distribution are looking at. And so what we want to ensure that the public knows is that vaccine safety standards are not going to be compromised in an effort to accelerate COVID-19 vaccine development or distribution. I also wanted to highlight just an example as how seriously we're taking this here in the United States, is that recently there's a vaccine candidate, and that trial has actually been halted due to neurological symptoms that the individual exhibited. So I just wanted to give that example of that. And the next thing that I wanted to highlight is inclusive clinical trials and how important it is to have those types of trials in order to reflect all the high-risk groups that are at risk for COVID-19. We need this safety and efficacy and to ensure that it's generalizable to the populations that we're trying to reach. Another important aspect is, of course, efficient distribution. Especially during this pandemic, it's important that we're able to get this vaccine out in an equitable manner, an efficient manner, once this vaccine is approved. And finally, something that I think is important is flexibility. Within our own local jurisdiction and within, the national guidelines and standards that are set out, to be able to decide how this vaccine distribution will look like for those of us here in San Antonio based off of local epidemiology and demand. So earlier I discussed inclusive clinical trials, and this is why inclusive clinical trials are so important. As many of you know, as many of you have seen in the hospitalizations related to COVID-19, we have specific populations and those with specific comorbidities that are at higher risk of contracting COVID-19. Those with asthma, hypertension, obesity, diabetes, CKD, severe obesity, and then of course having, multiple comorbidities just places you at higher risk for contracting COVID-19. And this slide here, it just highlights how disproportionate people of color have been impacted by COVID-19. As you can see, the rates are higher for Hispanics, Blacks, Asians, American Indians, and multiple different minorities. So I think it's very important to keep some of that in mind when we're thinking about vaccine distribution, because we want to make sure that everyone has the best access to care and that whoever wants to receive this vaccine is able to receive it. So now we'll go into a little bit about how a new vaccine is developed, approved, and manufactured. As many of you know, the FDA sets out the rules for vaccine candidates and new drugs and things like that. There are, of course, 3 phase trials. Phase 1, it's a smaller population, but it involves healthy volunteers, about 20 to 100. And they look at things such as, is the vaccine safe? Does it seem to work? Are there any serious side effects? And how is the size of the dose related to those side effects? Now, phase 2 involves several hundred volunteers, and researchers are trying to determine the most common short-term side effects, and they're looking at how the volunteers' immune systems are responding to the vaccine. Now, phase 3 is the one that everyone gets, more excited about, because that means the trials are almost over and we're in the next process of maybe having a vaccine available. Hundreds or thousands of volunteers are looked at and participate in the trial. And they're trying to see and compare those who have received the vaccine to those who do not receive the vaccine. They're looking at vaccine safety and efficacy, and they're also trying to find out what are the most common side effects. Now, the FDA is not going to license a vaccine. It must be safe and effective, and the benefits must outweigh the risks. So that's something to take comfort in that we have a whole organization just looking at safety and efficacy. So traditionally, it's taken about 10 to 15 years to create a vaccine. And so that timeline has been accelerated, and that's something that I've gotten a few questions on is, well, if the timeline is accelerated, is this vaccine safe? Well, as you will notice here, the clinical trials and the FDA review and approval process, as well as rapid manufacturing, those phases or parts of the process are all overlapping. So I just wanted to point that out, that, steps aren't not being taken. They're just overlapping in order to ensure that we get this vaccine out to, the people who need it the most in order to try and stop the spread of the COVID-19. Okay, I wanted to highlight the SARS coronavirus too and kind of just talk a little bit about the composition of it. So it is a single-stranded RNA enveloped virus, and on the outside of that virus is what is better known as spike proteins. And so these spike proteins on the outside, they actually bind to the host receptor site at the angiotensin converting enzyme 2. And this is what allows the entry into the cell. Now, all the vaccine candidates that are out right now, they focus on the spike protein. So there's so many vaccine candidates out right now, probably about 40 plus in various phases of the clinical trials. But I wanted to highlight a couple here that are in phase 3 of the clinical trials. They have the messenger RNA vaccines as well as a recombinant vector vaccine. So I wanted to highlight this article in the New England Journal of Medicine. It just begins to discuss some of the safety in regards to the messenger RNA 1273 vaccine. Now, the researchers here chose to focus on the older adult population. As many of you know, immunity and immune response tends to decline as we age. So I thought it was very interesting that they decided to focus on this population. The researchers actually added about 40 older adults to their study, and they grouped them from 56 to 70 years and from 71 years and older. Participants received 2 dosages of either 25 micrograms or 100 micrograms of the vaccine, and it needed to be administered 28 days apart. And of course, this vaccine's focusing on the spike protein. So what researchers found was that the mRNA-1273 vaccine induced high levels of both binding and neutralizing antibodies in older adults with the same time and dose-dependent trends in younger adults. So interestingly enough, both populations did not have any difference or need higher dosages or different timing of the vaccine to produce the same result. Now, this next sentence here is just some of the side effects that those individuals who are vaccinated experienced. They experienced headache, fatigue, myalgia, chills, and pain at the injection site. Now, I just wanted to mention this because when this vaccine comes out, it's important that providers are aware of some of the side effects so that they can let the patients know what to expect. None of the individuals experienced severe side effects. They were all mild to moderate in severity. And they actually didn't really experience these side effects at the first administration. It was actually more common after administration of the second dose. So this is another vaccine candidate, BNT162b2, and it is another modified messenger RNA vaccine, again, focusing on the spike glycoprotein. And researchers found strong antiviral effects as well as prevention of lung infection in 100% of the animals that were SARS coronavirus 2 challenged. Viral RNA was not detected in the lower respiratory tract in those animals that were immunized and challenged, and the nose was cleared of detectable viral RNA in 100% of the animals within 3 days after infection. Now, finally, the AD26 candidate. It is a recombinant vector vaccine that uses a human adenovirus to express the SARS coronavirus 2 spike protein. And the adenovirus vector was modified in order to not reproduce the virus messages. This researchers, which provided near complete to complete protection against virus infection in the lungs and nose. So this slide here, it just talks a little bit about how you can become a COVID-19 vaccine provider. There are certain steps that you need to take in order to enroll. There's actually a whole packet that I can provide to anyone who's interested in becoming a COVID-19 vaccine provider. And this information is actually also on our San Antonio website, COVID19.sanantonio. And then I've also included MTrack2, which is another portal which providers will need to register through. And then finally here, I just included a slide for y'all. It has a lot of resources for the healthcare community on the Infectious Disease Society website page. So a lot of resources about COVID if you get bored and just want to look more into that. And then this slide, I really take this slide to heart. With so much information out there, I just wanted to express to everyone my commitment, as well as the San Antonio Metro Health Department's commitment to the public, as well as everyone out there, in that we're committed to bringing you information as we learn it and sharing what we do and don't know. There's going to be so much out there that we are just going to have to sometimes say, we honestly don't know, but this is the information that we have. It's not yet known which vaccine will be available in what volume, at what time, with what efficacy, and what storage and handling requirements. And then we're available for any questions.
Wonderful. Well, this was really a good overview of where we are. And so thank you, Veronica. We have a few questions we asked and you can end the show. Maybe we can actually have, would you mind clicking on end and not, and yeah, there you go. So we have some folks that are part of our association and others have sent us questions that that they might have. So I would like to share some of the questions and see if we can have answers. And some of this might be preliminary, so we might not have answers to them. But one of the question was, will this vaccine be free? What are your thoughts on that?
Yes, so that's actually a very popular question that I've been getting. And yes, this vaccine will be free for whoever wants to receive it.
Wonderful. Now, I know I saw different phases of rollout that you kind of talked about. Um, will will there be kind of a separate study that would be done on just high risk healthcare providers and the effect of vaccine on them per se? Because I don't know if the vaccine trials are including people that are already at high risk in terms of multiple comorbidities into the vaccine trial. How does that process work?
Yeah, so that's a great question. I know some of the vaccine candidates, they are actually having problems, recruiting some of that group, especially minority groups. And so you bring up a very good point, because the people that we are wanting to receive the vaccine because they're at higher risk, they're not being really included in the trial because maybe they don't want to participate for whatever reason. But yes, that's a very good point. We're trying to reach a population, but we don't have the data yet on that.
Wow. Yeah, yeah, that's definitely a social determinant that I think it's a very keen thing that we'll keep an eye on to see how that would impact. Any two-part question here, any trials locally that we need to kind of keep an eye on that's going to kind of really impact? Because San Antonio has been in forefront in terms of researches and stuff like that. And then the second part of the question is, what are your thoughts on when do we see the vaccine?
So I know there must be, a trial here occurring locally, but to be honest, I haven't received that information yet. And then as far as when we might see a vaccine, I know we keep saying early November, but the more that I keep hearing about the candidates and what's occurring with their trials, I feel like maybe the end of December, maybe early January, depending on what everything's happening, especially with the new requirement that the FDA set out that they need the 2 months of the safety data before they get EUA approval.
Makes sense, makes sense. And there are a lot of concerns about people who are infected and then people who are immune. what are they saying about people who are infected who need to take a vaccine, people who are immune who needs vaccine? Is there anything going on that we need to know? Maybe it's too early to say.
Um, yes, probably a little too early to say. But do you mean those that have already been infected with COVID-19?
Yep.
Okay. And then maybe those that are immunosuppressed, is that what you mean?
So I know if they're immune that they might not need vaccine. So are there, or do they need a booster?
Oh, I see
Stuff
what
like
you're
that.
saying. Okay, so actually, there's been some data out there that you can become reinfected. Locally, we haven't seen that. And then also, those that have already had COVID-19, they're also saying that maybe that immune response doesn't last that long. Maybe it only lasts a couple months. But, again, that's a lot of maybes. Once this virus is out longer, we'll probably have more data on that.
And there is we're polarized now, and the whole country is polarized. And so there's just this group that says there's no need for vaccine, right? And we know we've dealt with anti-vaxxers from before.
Mhm.
What would be your parting words, knowing what's going on with minorities, knowing that how this is disproportionately affecting minorities and stuff that's going on all over, and we know what we know about anti-vaxxers? What would be your final parting words of this seminar to answer the question, is this even necessary? Is this vaccine necessary?
Yeah, so to be honest, when I hear things like that, I think, yes, that's your personal choice. But then I also think, about our loved ones. Yes, I might not die from COVID-19, but if I were to contract it and then pass it on to, say, my grandma who has multiple comorbidities, then she might not make it. So I think, to make it out of this, we all have to think about everyone and not just ourselves.
Very well said. And I mean, that is the perfect kind of message that we can send out to the community, that it's not always about us. I mean, I really appreciate you, Veronica, coming onto this platform. We'll share this to our viewers and everybody around town. And thank you for all you do, and all that you are actually trying to do really for the last few months in helping alleviate all these questions, talk about it, and open communication with not just providers but even with public. And I'm sure a lot of people are getting benefit from this. Thank you for your association with San Antonio Indian Nurses Association, and we look forward to doing events like these with you in the future.